Plastic surgery. For some, it's a taboo topic, but for others, it's a means to correct one of their frustrating physical features or maybe to build confidence from looking good. Stratis and Gayner Plastic Surgery has a lot of options for their patients. Dr. John Stratis and Dr. John Gayner join us today to discuss what their practice has to offer. Hey guys, welcome to Good Day PA. We're happy to have you.
Thank you.
So why don't you give me a little bit of background about yourselves, about your practice, and why you do what you do?
Well, we're both plastic surgeons, and Dr. Gayner is board certified in facial plastic surgery. I'm board certified in plastic surgery. And around 2006, 2007, I came up with the thought, having done a little bit of research, of dividing my practice up into facial and body, because they're distinctly different.
Sure.
And Dr. Gayner is a facial plastic surgeon in the area, so actually I contacted him and we had dinner together, see if this was something that we could do. And from then we joined practices, and now he does all the facial plastic surgery in our practice. I do all the body plastic surgery.
Interesting. That seems like a good partnership, huh?
Absolutely.
It is very.
And I know that you call yourself body focused. What kind of technologies does that mean? What sort of procedures do you do?
Well, our practice is what we call focused for you, which means I focus on the body, he focuses on the face. In terms of the body, and face also, there's a lot of things that are always coming up, and we test these products and see what works out for the patients. For example, I have a device which is basically a suction cup that connects to a machine, and you connect this to your body wherever you have some excess fat.
Yeah.
And it sucks your skin and fat into here and cools it down to 4 degrees centigrade. It's called cool sculpting. It gets rid of fat without surgery. Okay?
Wow.
And it's very
That's
popular.
remarkable.
It is. It's very popular now. We have a lot of different products that we use now that are non-invasive, and obviously we have the invasive traditional plastic surgery. I do liposuctioning. I do body contouring procedures. We can talk about the breast procedures that I do also.
Yes, this is actually really interesting to see. I've never actually seen breast implants up close. Why would I, right? But it's very interesting. It kind of makes it more approachable to me, I think, to see it.
Well, yes, and tell you the truth, when I do a consultation, we have patients come in for breast augmentation, for example. They'll try on these implants. They'll put a bra in and try on the implants and see what they can look like. And additionally, we have a 3D system that will actually mimic what they will look like. We get pictures of them and it mimics what they look like. We also show them different types of implants.
Yeah.
Silicone gel implants, saline implants, and the new gummy bear implants.
That's kind of a funny name. Gummy bear implants.
Well, it's
It's a
because
funny
the
name.
consistency is like gummy bears.
Well, let me ask you, Dr. Gayner, when somebody comes in, what would a consultation be like? What will they experience?
Right. The experience should be a two-way street. So they're going to tell us what their thoughts and concerns are, and we're going to outline for them options. And nowadays, as opposed to say 20 years ago where your option was surgery, surgery, and surgery, now we have non-invasive things like cool sculpting. Botox and fillers in my practice make up probably 60 to 70% of what I do.
I can believe
so you
that,
can
yeah.
literally come in over a lunch hour, get a little Botox, get a little filler, and take a few years off. So it's a much more approachable than it was in years past.
You're right, it's very approachable. Important to know, you have a surgery center right there at your office.
Yes.
So it's very simple.
Right. If you found our office, you found our surgery center. Just across the hall, we have a fully certified surgery center, which allows us to control all the aspects from the start to the finish. So it's very convenient for patients. It's much more discreet than doing it in a hospital setting, et cetera.
Really cool. So if people are interested, where do they find you? How can they get in touch with you?
You can come to our website, focusedforyou.com, or give us a call at 728-1700.
Perfect. This has been really interesting. Thanks, guys, for coming on. I think you made this very approachable for so many in the audience today.
Great.